This video is going to show you a lumbar spine strengthening exercise that works as a bit of an assessment tool to see if the patient needs to strengthen the lower back. It can be used for a number of injuries: lumbar disc herniation, non-specific lower back pain, mechanical back pain, just to name a few. It works well as an assessment tool for the practitioner to see how strong that patient is. Additionally, the patient can find a way of self-managing their condition and making sure that they can progress the exercises when they're on their own. We start off with flat against the floor, and the way it's explained in a lot of the literature is you just want to get the chest off the floor and the head will flex down. You can have your arms by your side, you can have arms here. I'm not too fussy about that, but as long as your chest is off the floor, your arms off the floor, your head's down, and you can just hold that position. You don't want to overextend the back because it might pinch, especially with people with lower back pain. You just want to remain neutral, have your chest off the floor, and if you run your hand up your back, you can feel these muscles, they're quite solid. If you see a patient struggling and they're starting to shake, or they're getting closer towards the floor and they're unable to maintain the position, then you'd obviously stop the test and take the time down. The way to interpret this exercise is closer to 2 minutes is considered to be a good score. Anything a minute and below is considered to be quite poor. Athletes are usually considered to get a higher score as well, rather than a sedentary population. So it's definitely a useful tool to trial, because if you've got a patient that can only hold this exercise maybe for 10-20 seconds, you know that's a kind of an in for you to try and progress that time, and it's quite clear for a patient, well, okay, normal values are about 1 to 2 minutes, whereas I'm only holding this for a good 10-20 seconds. There are many facets and many pathologies that lead to lower back pain, so it's not a one exercise fits all, and it's not going to be a quick fix. It just works as an assessment and strengthening tool going forward. So thank you very much for watching. I hope you found that useful.